Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Furosemide. The furosemide is a loop diuretic. This also acts on sodium, potassium, 2 chloride, which is present on the thick ascending limb of loop of Henle, and it is a loop diuretic. So it causes volume depletion by causing excretion of sodium and water. With the help of this sodium and water excretion, it causes volume depletion. And the uses of furosemide are important. The uses of furosemide is used in malignant hypertension. It can be used in hypertension with renal failure, mainly to cause the diuresis or loss of sodium and water in the urine, and thus causing relief to the patient. It can be used in renal failure with edema or hypercalcemia. We can use this because it causes loss of calcium. So in hypercalcemia we can use it in hyperuricemia. Is We can use the furosemide diuretic. Furosemide is also used if there is any thiazide resistance. If the patient is suffering from the thiazide resistance, then furosemide can be used. Furosemide can be used for its vasodilatory action also. Then, so if you use the furosemide with ototoxic drugs, if we use furosemide by itself causes ototoxicity. So the ototoxicity will increase if you use furosemide with ototoxic drugs. Then if NSAIDs are used with ototoxic drug, sorry, NSAIDs are used with furosemide, then NSAIDs will blunt the action of furosemide and will decrease the effectiveness of furosemide. So NSAIDs should not be given with furosemide because NSAIDs will decrease the effectiveness of furosemide. Then side effects of furosemide causes excretion of sodium and potassium and chloride. So as a result, it causes hypokalemia, it causes hyponatremia. Because it causes excretion of chloride, also it causes hypochloremia. Then it also causes volume excretion. Along with that, water is also lost, so it causes hypovolemia. It results in hyperuricemia. And ototoxicity is one of the important side effects, and it also causes hypomagnesemia also. So these are the side effects of furosemide.
thank you and thank you for watching.